Hi, this is EK. So today we're going to talk about 10 commonly tested diseases on the Nclex. But before that, let us talk about a few housekeeping rules. When you arrive at your test center and you're given a plain sheet of paper, jot down everything you have crammed in your head onto the paper. But make sure you have been cleared to start writing. Do not start writing until you are cleared to do so. Writing down things you have crammed, like lab values or difficult to understand concepts, will help you keep them fresh, at least on paper, so you can use it as you go along on the test. Remember to wait until it is okay to write before you do that. The other thing is, do lots of practice questions as you prepare for the Nclex. You can study all you want, but until you actually do practice questions, you will not know all of the tricks. And it also helps you gain mastery of concepts, so you're able to fine-tune and narrow down your understanding. The third housekeeping issue I want to address is, if you have read a question carefully and you're finding it difficult to arrive at the correct answer, pick the umbrella option. By that I mean the option that is broad and contains a lot of information. Typically, that would be your best bet. The final housekeeping rule I want to talk about is, if you have two options that are similar, knock them both off. So for instance, an option that says 1 teaspoon of sugar and another that says 1 cube of sugar, pretty much they mean the same thing. So knock them off. They are usually both incorrect. So we're going to go now to the 10 diseases I want to talk about today. The first disease I'm going to talk about today is Stena Gravis. Some Nclex questions would ask if the paralysis is ascending or descending. So the paralysis or muscle weakness in Stena Gravis is descending. Stena Gravis typically starts around the eyes. The upper eyelids will droop, which we call ptosis. And then the person develops double vision and maybe difficulty speaking, difficulty swallowing, and shortness of breath. So it's a descending type of muscle weakness or descending paralysis. On the flip side, the second disease, GuillainBarre Syndrome, has ascending paralysis or ascending muscle weakness. So typically, the weakness starts from the feet, then up to the legs, and it works its way upward. The person is in trouble, or death usually results when the respiratory muscles are affected and it goes upward. GuillainBarre affects the nerves outside of the brain and the spinal cord, which is opposite of multiple sclerosis, where the disease affects the brain and the spinal cord. In multiple sclerosis, there is something called the Charcot's triad, which is nystagmus, intention tremor, and dysarthria. But the signs and symptoms will be fatigue and difficulty walking. So that's multiple sclerosis. That was our third disease. The fourth disease we're going to discuss is Addisons Disease, which is caused when the adrenal glands produce insufficient cortisol. One of the classic signs of Addisons Disease is a darkening of the skin, a bronze-like skin pigmentation, and in Addison's crisis, low blood pressure. The flip disease to Addison's, which is low cortisol levels, is Cushing's syndrome, which is hypersecretion of cortisol. So it's the opposite. This typically will result in a rounded moon face, a buffalo hump, which is a hump between the shoulders due to deposits of fat tissues. So Cushing's syndrome is opposite to Addison's. There's low cortisol in Addison's, there's high cortisol in Cushing. The sixth disease is Graves' disease, or hyperthyroidism, also called goiter. The thyroid gland hypersecretes the thyroid hormone, and typically you see this person with exophthalmos, which is bulging eyeballs. The person has anxiety, sometimes hand tremors, and insensitivity to heat. So heat insensitivity. So those are the first 6 diseases. Next, we're going to go to diabetes. Diabetes is a pretty common disease. It affects a lot of adults as well as children, type 2 typically for adults. In discussing diabetes, I want to draw attention to a few things. The first is, when does the nurse determine whether to give a simple sugar or glucagon to a patient that has very low blood sugar? If the patient is arousable, we give orange juice, milk for children or infants. If the patient is non-arousable, we give glucagon. It will not be safe to give a simple sugar. So that's the distinction, the patient level of consciousness. I also want to talk about hemoglobin A1C. Sometimes the Nclex will refer to it as glycosylated hemoglobin. That is a measure of your blood sugar control long term, so a 3-month period. It's not blood sugar for that day, it's blood sugars on the average for the last 3 months or so. That's glycosylated hemoglobin or hemoglobin A1C. Next, I want to talk about 2 syndromes associated with diabetes. The first is dawn syndrome. So dawn as in early morning. That syndrome typically is common with diabetics, where the blood sugar starts to creep up or rise between the early morning hours of 5 a.m. and 8 a.m. To counteract that or to take care of that problem, we give a long-acting insulin at bedtime. So a long-acting insulin like Lantus is given to the patient at bedtime that kicks in much later in the night or in the early hours of the morning. The second syndrome is Somoji. Somoji effect is in the middle of the night, diabetics will have very low blood sugars. The blood sugar will drop precipitously. And to counteract Somoji, we typically will give the diabetic a bedtime snack. So if you want to remember Somoji, you can say SS. Somoji, snack. That pretty much for now is all I would talk about diabetes. The next disease I want to talk about is hypertension. So in hypertension, we do a lot of patient teaching. There are modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors are race, age, and gender. You cannot change your race, your age, or your gender. But then there are many risk factors that are modifiable. Stress reduction, exercising regularly, cessation of smoking, which means quit completely. So if you see an answer on the Nclex that talks about cutting down the number of cigarettes per day, that is not the correct answer. The answer is to stop completely. Reducing fat intake, like you know, and so on. Those are all modifiable risk factors. Also, with hypertension, we give the antihypertensive medications or cardiac medications also, even when a patient is NPO on the morning of surgery with a sip of water. On the Nclex, they will test you to know if you understand that cardiac meds or antihypertensives can be given on the day of surgery with a sip of water. The positioning for a patient, if they have increased blood pressure, is head of bed elevated. The next disease we're going to talk about is angina, which is chest pain, crushing, stabbing chest pain, relieved by nitroglycerin. That is the key. So recently the nitroglycerin protocol changed. Before now, patients were advised to call or dial 911 after they had taken 3 tablets 5 minutes apart sublingually. Now in the home, the protocol has changed. Patients are to dial 911 if they do not get relief after the first tablet. So nitroglycerin tablets are taken sublingually. However, on the Nclex, sometimes they trick you and say, can you give a patient a sip of water before you put the nitroglycerin tablet under the tongue? Absolutely. That tablet is supposed to dissolve, and if the mouth is dry, it's not going to dissolve quickly or may not even dissolve. So a sip of water, and then you put the tablet under the tongue. I did not say drink it with water. A sip of water first, then you put the tablet under the tongue. There's a distinction. The final disease we're going to talk about is Parkinson's disease. It's a disorder of the central nervous system that affects movement and also often includes tremors. Usually the tremors will start in one hand and then go to both hands due to low dopamine levels. So once again, some of the signs and symptoms are tremors, stiffness, loss of balance. We teach these patients to move close to the edge of the chair or wherever they are sitting, a good support chair with a back, and to rock back and forth before getting up to initiate movement. One of the key teachings also for a patient with Parkinson's and is on the medication Sinemet, which is also called carbidopa or levodopa, is to warn the patient that a side effect is orange-colored or dark red urine, saliva, and sweat. So they are not to be alarmed if their bed sheets or their clothes get stained orange, dark red, or brown. I think those are the 10 diseases we're going to cover today. We're going to pick up another 10 next time. I hope this is useful. Thank you for checking in with EK. Please like, comment, and subscribe. Thank you.